Welcome to Training Module 1 and congratulations on the purchase of your new DermaFrac system. In this module, we'll start by discussing skin and the rejuvenation process, followed by the details of the DermaFrac treatment concept. Then we'll discuss combination therapy using your system and the benefits of offering DermaFrac treatments within your business. The skin we want is youthful. That means it's supple and smooth, it's even in its color, and it's wrinkle-free. It's also well hydrated. The reality of our skin aging process is that from childhood through adolescence to middle age, our overall health and our environment, and in particular our sun exposure, are extremely important to how our skin looks as we age. As we age, the epidermis and dermis lose their thickness, and the loss of collagen and elastin fibers leads to skin laxity or looseness and distortion of the normal skin structure. If we can slow down or even reverse these processes, we can help control the aging of our skin. The epidermis is the thin outermost protective layer of our skin, which contains our melanin, which controls our pigmentation, and this is the protective layer from the sun. The dermis, which is much thicker than the epidermis, contains our collagen and elastin fibers. This is also where our nerve endings and our blood supply resides. And it's very important that we be able to reach the upper levels of the dermis to accelerate our skin rejuvenation process. One of the methods employed with the DermaFrac concept is the idea of microchanneling, which is a well-proven technology. Microchanneling, using a series of very fine microneedles, creates a gentle mechanical injury that initiates a healing response in the skin. This stimulates a new collagen formation on its own. But it also creates mechanical channels or pathways that allow us to introduce topicals through the stratum corneum, which is the outermost layer of the epidermis, through the entire epidermis and into the papillary or upper structure of the dermis. Microchanneling or microneedle rolling is supported by numerous clinical studies that have been performed around the world. The initial concept of microneedling was invented by Dr. Des Fernandez, a plastic surgeon in South Africa, and his work goes back to the late 1990s. Today, manual microneedle rollers are used around the world. These rollers can be used in medical procedures under anesthesia with needle lengths from 500 microns all the way up to 2 millimeters in length. But they're also offered at home with needle lengths that are much shallower, from 150 microns to 300 microns. As you can see by these slides, a 250 micron depth will penetrate through the epidermis and into the upper levels of the dermis. And a microchannel created by a microneedle roller in fact creates a pore or a pathway through the epidermis. Skin rejuvenation is also dependent on topical infusion to accelerate and enhance the cell renewal and skin rejuvenation process. The DermaFrac concept involves creating microchannels while simultaneously infusing topical ingredients while under vacuum occlusion. The skin is put under tension through vacuum occlusion created by the control console and the handpiece. This gentle tension ensures that the microneedles within the microchannel roller tip cap penetrate uniformly and to their full depth of penetration. The microneedles create pathways and allow topicals to penetrate through those microchannels to a depth of up to 250 microns deep, which is just below the dermal epidermal junction. And this is really the innovation that you'll be offering within your clinic, and something that is not done with any other system besides DermaFrac and the DermaFrac treatment. DermaFrac can be performed by physicians, but can also be performed by estheticians. This can save significant clinic time for the medical professional. As you can see by these slides, the topical infusion of active ingredients adheres to the walls of the microchannel pores that were created when simultaneously infused using the handpiece. DermaFrac can be used in combination therapy, as the system can be converted to a microdermabrasion system, which can precede the dermafractional topical infusion, which is then followed by light-emitting diode therapeutic light therapy. This combination therapy done in a professional setting, the DermaFit, the dermal fractional infusion therapy take-home regimen, or any other high-quality skin therapy system prescribed by the skincare professional. As the system is modular, it can offer standalone treatments of advanced crystal-free microdermabrasion, of dermafractional infusion therapy, or LED light therapy with 3 unique wavelengths that are used for various skin conditions. One of the advantages of DermaFrac is that the fractional infusion therapy can be performed without first performing a microdermabrasion peel. This means that the stratum corneum may be left intact on certain patients, and in particular this is a treatment that can be offered during the summer months when patients are normally undergoing a lot of sun exposure. This can provide additional revenues to your aesthetic business during the somewhat slower months of the summer. Let's discuss microdermabrasion as an overview. The exfoliation process in our skin is natural, with a new epidermis forming generally each month. The outer layer of the epidermis, the stratum corneum, is only 10 to 15 cells deep. These cells normally exfoliate on their own, but when we use a microdermabrasion system, we remove the stratum corneum, and therefore we accelerate this renewal process. Microdermabrasion starts with vacuum occlusion, and the vacuum pulls the skin into contact with a crystal embedded pad. That crystal embedded pad contours to the undulations of the skin. The stratum corneum, oils, and bacteria are all simultaneously removed as the handpiece is passed over the skin. The vacuum also has the benefit of pulling the blood supply into the epidermis, which helps with the healing response. And microdermabrasion, of course, dilates and opens the pores as it cleans them. This slide shows normal skin with the stratum corneum intact before the procedure, and then what the skin looks like after 2 passes with the microdermabrasion handpiece. We always recommend a minimum of 3 passes to ensure a quality depth of peel. Microdermabrasion works because the abrasive surface cleans and exfoliates the epidermis. The vacuum opens the blood vessels, enhances collagen growth, it accelerates the skin renewal process, and the epidermis and the dermis thicken with multiple treatments. This all leads to a more youthful appearance. Another added benefit of microdermabrasion is that by removing the stratum corneum, the exposed skin within the epidermis is now more receptive to topical ingredients and the nutrients contained within. DermaFrac also offers light-emitting diode therapeutic light therapy. The Cool Breeze LED wands also provide a gentle, soothing airflow through the wand directly onto the skin. This helps cool the high-intensity pulse light while simultaneously providing a soothing experience for the client. There are many different indications for use for LED wands. This therapy is completely non-ablative with no downtime. It's an ideal technology for combination therapy, and there are numerous clinical publications supporting the various types of LED light therapy. DermaFit is an at-home treatment regimen. DermaFit is generally indicated for use after a series of professional treatments with the DermaFrac machine are completed, allowing the patient to maintain their healthy skin. The DermaFit kit contains a manual microchannel roller, a daily peptide replacement serum, and an SPF 30 UVA UVB sun protectant. This sun protectant is chemical-free and water-free and has a light tint to it as well. The DermaFit kit is typically used several times per week, but may be used as often as each day. By providing DermaFrac treatments in your clinic or spa, you'll be providing effective non-invasive treatments that use proven technologies in combination, which include the microchanneling concept, vacuum-assisted infusion of topicals, microdermabrasion peeling, as well as therapeutic LED light. All of these can be done efficiently in combination therapy with your DermaFrac system, or you may offer standalone treatments to expand your menu options. The important thing is that you customize each DermaFrac treatment to your patient's skin condition. The DermaFrac system provides several types of infusion solutions. For anti-aging, a cocktail of advanced peptides is used. For deep hydration, a hyaluronic acid antioxidant solution is provided. For gentle and progressive skin lightening, a kojic acid-based solution is provided. And for acne treatments, a salicylic and lactic acid solution is provided. The DermaFrac creates microchannels similar to fractional laser treatments without the risk of collateral damage and associated downtime that can be caused by the heat of a laser. This also eliminates any post-treatment consultation and patient management issues. If DermaFrac infusion is performed without microdermabrasion prior to it, the stratum corneum will be left intact. This allows you to provide summertime treatments for patients who would otherwise not have skin rejuvenation treatments done while they are actively exposed to the sun. DermaFrac treats fine lines in aging skin, skin that is sun damaged, hyperpigmented skin, skin that's prone to oil and acne, dry or patchy skin, blackheads and whiteheads, acne scars, and large pores. It can also be used on any part of the body, and obviously the face is the most popular area to use the system on, but also the neck and décolleté, the back of the hands, and even the feet. And other body treatments can be considered as well, including scars and stretch marks. DermaFrac is safe for all skin types because it does not use heat or harsh chemicals. Congratulations, you've reached the end of Training Module 1. Please continue to Training Module 2.